Hi, my name's Jordan Reeves, and I did my presentation on mumps. Go to the next slide. So, the first thing we'll talk about is the pathogens. Mumps is an MU virus. It's a negative sense single stranded RNA virus. It belongs to the paramoxaviride family. It uses HN protein for attachment to host cells, and the HN protein, they act as the attachment protein binding to the salicylic acid receptors on host cells and enabling the viral attachment. So they prevent the virus from essentially like clumping together. It also utilizes the F proteins, which mediates the binding of the viral envelope with the host cell membrane, allowing the virus's genetic material to get inside the cell. Both of these proteins are critical for the viral life cycle and are major targets for the immune system. Came from the CDC. It replicates in the respiratory tract, so it first will target that, and then it starts multiplying inside the nose, in the throat, in the epithelial lining, and from there it just starts to spread through the bloodstream, and it can go out and get distributed to a bunch of different organs, including the salivary glands, so inside your mouth, the ovaries, testes, pancreas, and even the central nervous system as well. The immune response that takes place is that these tissues, and particularly the parietal gland, leads to the famous swelling seen in the mumps, which we will look at here in just a few slides. This photo here is a photo of what mumps, the bacteria itself, actually looks like. So you see on the outside the HN proteins, which is what we had just kind of talked about, and then the F proteins as well, has the polymerase, and then the nucleocapsid. It looks kind of crazy. I guess going a little bit more into transmission, it's spread through respiratory droplets, so coughing, sneezing, speaking. It's very contagious when you're in close settings. It's contagious 2 days before the symptoms will appear, and it remains contagious for 5 days after the swelling. Mumps can survive on short-term surfaces for a while, so it often will happen in our homes, so like kitchens and dormitories. When you go to college, they can live on there. So hand hygiene and avoiding shared objects, as well as staying home while you have the symptoms, can help reduce the spread of mumps. So sharing drinks and utensils can increase the spread. And then the vaccine is what prevents most cases, but we will get to that in just a minute. It's a photo of how it kind of starts. So it enters into that respiratory tract, like we were saying, spreads to the local lymph nodes, which are right in your neck, and then it spreads down to the other lymph nodes that you have throughout your body, goes into the spleen, and then the virema, which is inside of the reproductive organs, and then it generalized, and it'll spread to the salivary glands and then the other body sites. So it incubates for 5 to 15 days inside your body and kind of goes through, and then on day 20 you can see the true symptoms of this disease. Going more into some symptoms that occur, the most obvious symptom that occurs are the swelling of the cheeks. As you can see in this photo here with this girl, on the left side, it's like the parietal gland is normal, and then the right side, you can see the swollen parietal gland. It's incredibly uncomfortable. The initial symptoms that someone will experience, though, can include fever, headache, muscle pain, and fatigue. You can also experience loss of appetite and some ear discomfort as well. Orchitis may occur in postpubertal males, and so most people are okay and they can recover. Um, yeah, most people are okay and they can recover, but sometimes there are longer lasting effects, like the complications can include meningitis, pancreatitis, and hearing loss. So these would be things that, if it's not treated or if you got a really bad case of mumps, then these things could follow you into later on after your body's defeated the virus. This is just another photo of like a more classic course and kind of what ends up happening. So it kind of breaks it down just a little bit more. So the headache, also known as malaise, the low-grade fever, the pruritus, so that's like more descriptive of it. It's tender, pain, and then the earache. The aseptic meningitis, like so on the other side, the more complications that you could see long-term will be that meningitis, the hearing loss, which is very rare, but there have been cases noted, acute pancreatitis, so nausea, vomiting, upper abdominal pain that you kind of just deal with for a while, the otitis, which is the most common in the males that have already hit puberty, so sudden onset nausea and vomiting, and then testicular pain and swelling. Diagnosis and treatment. There's diagnosis through the PT and PCR, so a blood test. There's unfortunately no antiviral like treatments that can help. They can't just like, give you a shot or anything that will make you better or provide a steroid. So primarily what they recommend is supportive care, so rest and hydration, making sure you're drinking lots of water, fluids, and you can use cold or warm compresses to kind of help relieve the swelling, especially because it's on your face. And in cases as well, you can use pain relief, so ibuprofen or acetaminophen to help decrease the swelling in the parietal area on your face. And yeah, the warm and the cold compresses for the gland swelling because it can be so incredibly uncomfortable. But the primary thing is getting your vaccination. So that's what it is over here, is that if you get the vaccine, that's the most like foolproof, like that you won't receive the mumps. Once you get it, unfortunately, it is a lot harder to maintain. And then these are the things that you do if you do end up with mumps. But if you get the vaccine in the first place, you should be okay. Demographics and AI. So mumps before the mass vaccination was an everyday childhood infectious disease in the United States, and it affected millions of children each year. Cases have decreased by 99% now after the scientists were able to come up with the MMR vaccine. Now the outbreaks only really occur in the areas where vaccination coverage is decreased, so like third world countries, we still see it there. And then also in close contact areas, so like college campuses, sports facilities, sometimes we still see that. But it's honestly most frequently now in parts of Africa, Southeast Asia, and rural areas. And artificial intelligence now actually uses more and more to identify outbreaks and predict areas of risk and analyze gaps in vaccination coverage. It can also assist health departments and in recognizing early patterns of disease transmission and assist clinicians by finding clustering symptoms which can suggest the infection. So AI has been really helpful in the process and the treatment of mumps, although again the vaccine is going to be the top thing. If you just receive your 2 vaccines, you're more than likely won't receive the mumps. It's a lot more common in kids too, but when you gather in areas like college campuses or sports facilities, you can also see it. You can have outbreaks there as well. Here are my references. So the CDC had a lot to do with it, National Institute of Health, and then the World Health Organization, and then of course our microbiology book. So that was my presentation on mumps. Thanks.